Welcome to Project First Line, Infection Control Concepts in Healthcare, Immunization of Healthcare Personnel. In this presentation, we'll discuss the immunization of healthcare personnel in healthcare settings and its important role in infection control. We'll also review vaccine recommendations and gain an understanding of the main benefits and barriers to vaccination uptake among healthcare professionals. Like hand hygiene, personal protective equipment, and environmental cleaning and disinfection, vaccination is a critical tool in our infection control toolbox. Immunizations help to protect our healthcare professionals and their patients from preventable infectious diseases. Due to the nature of your work, the potential of exposure to various infectious diseases is higher, and it's important to take steps to reduce the risk of disease transmission. Comprehensive immunization policies can help to protect staff and vulnerable patients receiving healthcare. Before we move into recommendations, let's start with general concepts of immunity and the immune response. To understand immunity, we first need to understand the difference between the terms vaccination and immunization. Vaccination is the act of administering vaccines into the body the appropriate number of times to fight off infectious diseases through a templated response for your immune system to follow. Immunization is the process by which a person becomes protected against diseases through either vaccination or exposure to the disease. In other words, vaccination is the action of giving a vaccine to induce the immune response, while immunization is the end result of the immune response, where the person gains protection from the disease after illness. Understanding the types of immunity. Immunity can be achieved either through vaccination or through illness onset and the subsequent immune response. Let's look at some of the benefits and drawbacks associated with each. Vaccine-induced immunity is achieved through the appropriate number and timing of vaccinations. Vaccines can produce the immune response without making us sick by imitating an infection and providing a templated response for our immune system to follow. As such, vaccination creates a more predictable immune response and reduces the likelihood of community spread and the burden we see on our healthcare system in terms of staff shortages due to illness and hospitalizations. Achieving natural immunity can be less predictable for the immune system and can be associated with long-term health complications, such as long COVID. As incubation periods can vary for illnesses, community transmission has a greater foothold among the unvaccinated and can spread to others before you even know you are sick. It's important to know the difference between vaccine-induced and natural immunity in order to understand why scientists recommend vaccines and consider them safer than getting the infection. Review of the immune response. Both vaccine-induced immunity and natural immunity evoke the immune response. Regardless of how an antigen enters the body, whether through an infection or by vaccination, the immune response mounts by recognizing the antigen. This recognition will make the attacked cells produce cytokines, or messenger proteins, that activate or summon macrophage immune cells. This is often referred to as innate immunity. The activation of macrophages calls up T cells to help defend against the antigen. This is called adaptive immunity. The activation of T cells produces helper T cells that will activate B cells to produce antibodies. Lastly, we reach resolution, which is the process of actively clearing a pathogenic stimulus, breaking down pro-inflammatory mediators, and killing immune cells. The final stage of the immune response is memory formation, so that our immune system can quickly respond to the antigen in the future. Herd immunity. Now that we've had a refresher on the immune response as triggered by either vaccine or illness, let's discuss the concept of herd immunity. When enough of a population is immune, either through vaccination or immunity developed from a previous infection, we see indirect protection in the community against infectious diseases because there are less people being infected and infecting others. Understanding herd immunity helps us understand why routine vaccination is still strongly recommended against all vaccine-preventable diseases. During outbreaks, herd immunity for a disease means that it is less likely for a person without immunity to be exposed to an infectious person. This is the only way to provide protection from illness for those who are immunocompromised or cannot get vaccinated. Here's a snapshot of herd immunity. Herd immunity varies from one disease to another, depending on the contagiousness of the disease. For instance, herd immunity for smallpox is achieved when around 80 to 85% of the population has immunity, while measles, the most contagious, vaccine-preventable disease, requires that at least 91% of the population has immunity before we see the benefit of herd protection. When herd immunity goes below its threshold, the possibility of outbreaks and epidemics grows. We've seen this trend occur recently with measles. While the estimated immunity for measles is lifelong, herd immunity can be hard to achieve because one contagious person can infect up to 18 others. Active immunization makes the most significant contribution to herd protection. With the COVID-19 pandemic fresh in our minds, let's take a look at what herd immunity looks like for the SARS-CoV-2 virus. As the virus continues to mutate, some of this is not confirmed, like the estimated duration of immunity, but studies indicate that we have the protection of herd immunity when 70 to 80% of the population has some form of immunity. The range fluctuates depending on the contagiousness of the variant. For example, with the Omicron variant, herd immunity was not achieved until 90% of the population had some form of immunity. Challenges with immunity. There are challenges present with achieving immunity in a population. Some considerations to keep in mind as you provide care in your healthcare facility are waning immunity, immunosenescence, and immunocompromised individuals. Some immunity is lifelong and some are not, regardless of how the immunity was gained. Waning immunity depends on the type of pathogen, its mutation, vaccine formulation, and each individual's immune response. Examples of vaccine immunity that can wane over time are tetanus, diphtheria, pertussis, influenza, and COVID-19. Another consideration for vaccination is the relationship between immunity and aging. Immunosenescence is the gradual decline in the function of the immune system that occurs with aging that may result in an inefficient immune response to novel antigens and an inability to develop proper immunity against infections and upon vaccination. Vaccination recommendations for people 65 and older are different due to the immunological changes associated with aging. Similar to the relationship between the immune system and aging, those that are less healthy due to a variety of factors can have a reduced ability to mount an immune response that is strong enough to fight off infection or establish immunity against an illness. Vaccination recommendations. Recommended vaccines for healthcare personnel. As healthcare personnel, your work puts you in direct contact with patients, and you may handle material that spreads infection. The CDC recommends the following vaccines to reduce the chance that you will get or spread a vaccine-preventable disease. All healthcare workers should remain up to date on vaccines for COVID-19, influenza, hepatitis B, measles, mumps and rubella, varicella, and tetanus, diphtheria, and pertussis. You may have other recommendations based on your age and other health and lifestyle factors. Talk with your doctor to determine whether you have additional vaccine recommendations. These recommendations for the immunization of healthcare personnel can be found in the Advisory Committee on Immunization Practices, referred to as ACIP. The document is linked at the bottom of this slide. As we move through each of the recommended vaccines on the following slides, continue to reference ACIP for additional information. Let's start with COVID-19 and flu. General disease information. Both are contagious respiratory illnesses caused by two different viruses, SARS-CoV-2 and influenza, respectively. They spread mainly by respiratory droplets. Flu season starts in the fall and peaks in the winter. For healthcare personnel, it's recommended to get the vaccines annually. For COVID-19, healthcare personnel need to stay updated with their COVID-19 vaccine as recommended. Special considerations to remember here are that COVID-19 is an evolving virus. Recommended age-appropriate updated doses are sometimes more frequent than once a year. Let's now compare the side effects of the vaccines with those of the disease. Before moving forward, it's important to always remember that the burden of COVID-19 and influenza varies significantly by age and underlying health conditions. While COVID-19 has been causing mild illness recently, it's important to remember that the disease can cause complications that lead to hospitalization and death. Vaccine side effects usually last 1 to 2 days, with the most common side effects reported as a sore arm at the injection site, mild fever, fatigue, and headache. Myocarditis is a rare complication reported with the COVID-19 vaccine. Illness with both diseases lasts 3 to 10 days. Symptoms can include fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, and new loss of taste or smell. Complications include pneumonia and long COVID, hospitalization, and death. Complications continue to emerge with each variant of the virus and with additional data trends that develop over time. Hepatitis B. Hepatitis B is a blood-borne communicable disease of the liver caused by the hepatitis B virus. Looking at the frequency of vaccination, adults aged 19 to 59 years and greater than or equal to 60 years with risk factors for hepatitis B should receive a 3-dose series over 6 months, or a 2-dose series over a month. Revaccination may be recommended for healthcare personnel that are at risk for exposure to blood and body fluids, and unvaccinated or unsure of their vaccination history. An interesting fact to remember is that 2 out of 3 people living with chronic hepatitis B do not know they are infected. This is what we call a silent infection, where people can unknowingly pass the infection to others, including healthcare personnel. Side effects of hepatitis B vaccination versus the illness. The vaccine side effects are mild and last 1 to 2 days. Soreness at the injection site is the most common side effect, and immunity is lifelong for most healthy individuals who initiate hepatitis B vaccination at less than 6 months of age. Acute illness of hepatitis B lasts up to 6 months and includes abdominal and joint pain, nausea and/or vomiting, fatigue, fever, and jaundice. It's a lifelong infection that can cause serious complications. Most common are cirrhosis, or scarring of the liver cancer, liver failure, and even death. Measles, mumps, and rubella. Measles, mumps, and rubella, or MMR, are all contagious viral infections that are transmitted primarily through the respiratory pathway. Vaccination is recommended for healthcare personnel who were born during or after 1957 without documentation of natural or vaccination immunity, and for all healthcare personnel who have no proof of immunity, including those born before 1957. Special considerations include Healthcare facilities should consider policies for healthcare personnel that recommend 2 doses of the MMR vaccine during an outbreak of measles or mumps and 1 dose of the MMR vaccine during an outbreak of rubella. Vaccine versus illness. The most common vaccine side effects includes a sore arm at the injection site, fever, mild rash, and, sometimes when the vaccine is administered later in life, temporary stiffness and pain in the joints can occur. Some rare complications include seizures, or an infection that could be life-threatening in those with serious immune problems. On the other hand, illness with these 3 diseases are mostly moderate to severe and last from 4 to 10 days. Measles and rubella present with fever, rash, cough, runny nose, and red, watery eyes. Mumps usually causes fever, headaches, muscle aches, tiredness, and swollen salivary glands. All 3 infections can be associated with severe complications. Complications from measles can include ear infections, pneumonia, brain damage, and death. Complications from mumps can include swelling of the testicles or ovaries, deafness, inflammation of the brain and or tissue covering the brain and spinal cord, and, rarely, death. Complications from rubella can include miscarriage or serious birth defects if the infection happens during pregnancy. Tetanus, diphtheria, and pertussis. Tetanus, diphtheria, and pertussis are bacterial infections that are covered through the Tdap vaccine. Tetanus is an infection of the nervous system. Diphtheria can be either a respiratory or cutaneous infection, and pertussis, or whooping cough, is a highly contagious respiratory infection. Since 2005, the Advisory Committee on Immunization Practices has recommended that healthcare personnel receive a single dose of Tdap. After receiving the Tdap vaccine, a booster is recommended every 10 years. Vaccine versus illness. Tdap vaccine side effects last 1 to 3 days, with the most common symptoms reported as soreness of the injection site, mild fever, headache, fatigue, nausea, vomiting, diarrhea, and a stomach ache. More serious reactions such as seizures, nonstop crying for 3 hours or more, or a high fever after vaccination happen less often. Rarely, vaccination is followed by swelling of the entire arm or leg, especially in older children when they receive their 4th or 5th dose. Let's now discuss the illness, starting with tetanus. Tetanus can cause painful stiffening of the muscles. Complications include being unable to open the mouth, having trouble swallowing and breathing, or even death. Moving on to diphtheria. Diphtheria's hallmark feature is the pseudomembrane, which is a thick gray coating of dead tissue that builds up in the nose and throat and makes it very hard to breathe and swallow. Airway blockage is a deadly complication from respiratory diphtheria. If the toxin gets into the bloodstream, it can kill the tissue of other organs and cause kidney failure, myocarditis, or polyneuropathy. Moving on to pertussis. Pertussis is commonly known as whooping cough and presents with uncontrollable, violent coughing that makes it hard to breathe, eat, or drink. Pertussis can be extremely serious, especially in babies and young children, causing pneumonia, convulsions, brain damage, or even death. In teens and adults, it can cause weight loss of bladder control, passing out, and rib fractures from severe coughing. Illness from these 3 bacterial infections can last a month, and some symptoms of pertussis can last up to 10 weeks. Varicella. Varicella is a highly contagious viral infection caused by the varicella zoster virus that spreads through the respiratory pathway or by direct contact with skin lesions. It's a 2-dose vaccine administered at least 28 days apart. It's recommended for healthcare personnel without a reliable history of varicella vaccination or laboratory evidence of varicella immunity. In people with serious immune system problems, this vaccine may cause an infection that may be life-threatening. People with serious immune system problems should not get the varicella vaccine. Vaccine versus illness. The varicella vaccine is generally safe, but some side effects can occur, including soreness at the injection site. Some people have reported redness or a mild rash at the injection site, and others have reported a non-localized chickenpox-like rash. As with all vaccines and illnesses, complications are possible. The varicella vaccine has rare complications that includes pneumonia, infections of the brain, spinal cord covering, lungs, or liver, meningitis, and anaphylaxis. Varicella as an illness lasts about 5 to 10 days and presents with a red, itchy skin rash that turns into fluid-filled blisters. Additional symptoms often include fever, tiredness, a loss of appetite, and headache. The most common complications from varicella illness are bacterial infections of the skin and soft tissues in children and pneumonia in adults. Severe complications caused by the virus include cerebellar ataxia, encephalitis, viral pneumonia, and hemorrhagic conditions. Other severe complications are due to bacterial infections and include septicemia, toxic shock syndrome, necrotizing fasciitis, osteomyelitis, bacterial pneumonia, and septic arthritis. Other vaccines. Healthcare professionals should make sure that they are up to date on any other vaccines routinely recommended for them based on age or other factors. Talk with your doctor to learn which vaccines are recommended for you. These may include the shingles vaccine, which is recommended for all adults 50 years of age and older. Though not specifically recommended for healthcare professionals, the RSV vaccine can also be considered. Certain healthcare personnel and other healthcare roles may require additional vaccinations, including meningococcal, typhoid, and polio. Let's review our key takeaways. Vaccine hesitancy is a rising health emergency. Herd immunity is one of the most powerful tools to protect those in our community that cannot get vaccinated or have weaker immunity. Boosters or additional doses of vaccines may be recommended because immunity wanes over time due to a variety of factors. Vaccine immunity is more predictable than natural immunity. And staying up to date on your recommended vaccinations is crucial to protect your health, especially as a healthcare professional. Additional information and resources can be found on the following slides. You can keep exploring these topics on your own using the resources on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.